Whiplash is a non-medical term describing a range of injuries to the neck caused by or related to a sudden distortion of the neck associated with extension. The term whiplash is a colloquialism. Cervical acceleration deceleration (CAD) describes the mechanism of the injury, while the term whiplash-associated disorders (WAD) describes the injury, sequelae and symptoms. Whiplash is commonly associated with motor vehicle accidents, usually when the vehicle has been hit in the rear. However, the injury can be sustained in many other ways, including falls from stools, bicycles or horses. It stands out as one of the main injuries covered by the car insurers. In the United Kingdom, 430,000 people made a claim for whiplash in 2007, 75% of the UK's motor insurance claims, accounting for 14% of every driver's premium. Before the invention of cars, whiplash injuries were called railroad spine, as noted mostly during train collisions. After the invention of cars, the number of whiplash-related injuries have risen sharply due to an increase in rear-end motor vehicle collisions. The first case of severe neck pain arising from a train collision was documented around 1919. Given the wide variety of symptoms that are associated with whiplash injuries, the Quebec Task Force on Whiplash-Associated Disorders coined the phrase, whiplash-associated disorders. Whiplash symptoms. Symptoms reported by sufferers include pain and aching to the neck and back, referred pain to the shoulders, sensory disturbance, such as pins and needles, to the arms and legs and headaches. Symptoms can appear directly after the injury, but often are not felt until days afterwards. Whiplash is usually confined to the spinal cord, and the most common areas of the spinal cord affected by whiplash are the neck and the mid-back, middle of the spine. Whiplash treatment. According to the recommendations made by the Quebec Task Force, treatment for individuals with whiplash-associated disorders grade 1 to 3 should include manipulation, mobilizations and range of motion exercises. Non-narcotic analgesics and non-steroidal anti-inflammatory drugs may also be prescribed in the case of WAD 2 and WAD 3, but their use should be limited to a maximum of 3 weeks. A cervical collar should not be used for longer than 72 hours as it may lead to prolonged inactivity. Return to normal activities of daily living should be encouraged as soon as possible to maximize and speed full recovery. A different approach is taken by the National Institute for Neurological Disorders and Stroke, who suggest that treatment for individuals with whiplash may include pain medications, non-steroidal anti-inflammatory drugs, antidepressants, muscle relaxants, and a cervical collar, usually worn for 2 to 3 weeks. Range of motion exercises, physical therapy, and cervical traction may also be prescribed. Supplemental heat application may relieve muscle tension. Whiplash is a common disease, yet every individual needs unique treatment and care. We encourage people with whiplash and their families to learn as much as possible about the latest medical treatment and approaches, as well as healthy lifestyle choices. For more information about whiplash and how to treat whiplash, just click on the link at description or visit www.mainmd.com. Thank you.